we will just discuss some miscellaneous topics related to kidney and ureter, miscellaneous things. Okay. So see here, this is the kidney, this is the pelvis and the ureter, this is the artery, and this is the vein. What is this junction known as? This junction is PUJ, pelviureteric junction. What is this junction known as?
Juxtamedullary.
It is known as hilum. Hilum is the just the place where hilum is the depression where the renal artery, renal vein, and pelvis open. Okay, so here the anatomy is important. Vein is anterior. Okay, vein is anterior. Then comes artery. Then comes pelvis. Okay, VAP, vein, artery, pelvis. Okay, this is about the anatomy part. Remember, anterior, vein, then comes artery, then comes pelvis. Why? Because they asked 2 years back, I think. They asked, what is the, not in surgery, but anatomy, they asked, what is the arrangement of hilar structures in renal anatomy? What is the arrangement of hilar structures in kidney? Anterior vein, artery, pelvis, artery, vein, like that. They change the combinations. So, VAP, remember, anteriorly is the vein, then comes the artery, then comes the pelvis. Okay? Remember, this is an anatomy question. And then, what is the importance of left renal vein? Left renal vein. Please use pen to write. Can't understand what you are writing. Okay. Pen. Okay. So, what am, yeah, left renal vein. What is the importance of left renal vein?
Left renal vein is longer than the right renal vein.
Left renal vein is
longer than the right renal vein.
Okay. So, what is the use of it?
In transplant, like kidney transplantation, we remove from donor or left renal because it's a longer, so we can anastomosis easily.
Yeah. So see here, this is the very good. Who had told it? Very nice. See, it is the right kidney. This is the left kidney. What is this? And what is these are the major vessels? What are these two major vessels? One artery, one vein. What are these two major vessels? Tell, even if it is wrong, it's no issue. What are the two things which are growing? Which carries blood to every organ, which takes blood from every organ?
Inferior vena cava.
Yeah, this is the inferior vena cava. On the right side, it will be a little on the right side. This is the aorta on the left side. Okay. So see here, veins drain into the IVC. So the right side, it is little short. Anatomically, it is little short. Whereas the left side, it is little longer because of the location. It has to cross the aorta. It has to come into the IVC. Okay, it is longer. So as the left renal vein is longer in size, it is used for transplant. So anytime when we do a transplant, renal transplant, we'll take the left kidney only most of the times. Unless if it is contraindicated, we'll take the left kidney because we have a larger vein. So that to anastomose, it will be easy for us. Okay. So this is one important point of left renal vein. The other important point, so where do the right testicular vein open? Where will the left testicular vein open? Okay, just this is the like homework for you. Just after our class, you just revise anatomy once. Okay, where will the testicular vein and right testicular vein, where will it open? Okay, left lies behind. That is the small mnemonic for it. We'll remember like that. Left lies behind. Why is it so? You should tell me tomorrow. Okay. So this is about one thing about left renal vein we have discussed. Hilum we have discussed, and then nutcracker syndrome. What is this nutcracker syndrome?
Compression of left renal vein. Compression of left renal vein between aorta and the superior mesenteric artery.
Very good. So the left renal vein is compressed. Left renal vein is compressed between the aorta and the superior mesenteric vessels. Okay. So this will lead to hypertension. Okay. This is known as nutcracker syndrome. In the same way, there is a syndrome called Wilkes syndrome, superior mesenteric artery syndrome, Wilkes syndrome, which the duodenum will be crushed there. I'll tell you during GIT class. Okay. But just remember, nutcracker syndrome also, it is the left renal vein. And renal collar. See here, sometimes I told you this will be aorta here. The renal vein will go like this. It will split into two. It will encase the renal IV. It will encase the aorta. Again, it will combine. This will form a renal vein. So, renal collar. Renal collar is also formed from left renal vein. So, this is the importance of left renal vein. One is, first is transplant. Second is regarding the vessels. Left testicular vein and left gonadal vessels, they open into the left renal vein. Third is nutcracker syndrome. Left renal vein is compressed between the aorta and the superior mesenteric vessels. And finally, the renal collar is also formed by left renal vein. Okay. Clear these anatomy points?